Mr Deputy Speaker, JobKeeper showed the government can respond quickly in crisis, and sadly there is no denying the aged care crisis that we are in right now in Australia. Now, I'm heartened by the final report into the Royal Commission into Aged Care because it sets out pathways to our system which will treat older people with care, dignity and respect, and I think that that's really the key to it all. If we have the will to act decisively, we can act now. The Commissioners have called for a new Aged Care Act and system, and I think that that's a matter that we can all agree on. But the Prime Minister has indicated a 5-year time frame for a new Act. The government must act now on key recommendations because older Australians can't wait any longer, and we don't need a new Act to act on some of these key recommendations. Lengthy delays in providing aged care at home must be addressed immediately. Many elderly people qualify for care in their homes, but they are left on a merry-go-round for months or years searching for providers, and that's after being on the wait list. Their health can deteriorate to a point where they are hospitalised or need residential care really prematurely. This is not what they want, it's not what their families want, and it costs individuals and taxpayers far more than in-home care. The system is broken and it can't wait 5 years to be fixed. The Commissioners have called for immediate improvements to food and nutrition. They heard evidence that 68% of residents in 60 Melbourne nursing homes were either suffering from or at risk of malnutrition. So nearly 7 out of 10 residents were at risk or suffering from malnutrition. That is horrific. I just can't believe that that is the Australia that we live in. We need to make sure that the government's initial per-resident funding boost for providers really delivers to the individual who is in aged care, to the person who is in aged care. We need to make sure it delivers nutritious meals. The second recommendation for immediate action relates to people living with dementia. Recently, members would have heard from Dementia Australia that the aged care system lacks consistent quality support for people with dementia. Now, dementia is now the biggest killer of women in Australia. More timely dementia diagnosis, pathways designed with people living with dementia, their families and carers, and a supported, skilled workforce cannot wait 5 years for a new Act. Thirdly, the Commissioners call for immediate, better controls on restrictive practices. I am pleased the government has initiated some of these measures. And lastly, the Commissioners call for palliative care to be core business. Advocates advise of the improved patient outcomes and economic benefits of integrating palliative care with aged care. We need to be providing more compassionate care for people nearing end of life, at home if they wish, rather than emergency hospitalisations. Commission's core recommendations give shape to the top 10 things which peak bodies have identified through consultation and what most older Australians want. The Commissioners agree there needs to be increased funding for aged care with greater transparency and accountability of how individuals and taxpayers' funds are spent. Older Australians say they want to see transparency, informed choice and greater control over their funds. And I call on the government to immediately progress measures based on previous Centre Alliance legislation proposals. Aged care providers must be required to disclose their income, their spend on food and medication, what they spend on staff and training, accommodation and administration, and payments to parent organisations and directors. You know, Australians can't believe that this information is not required to be provided to the Australian taxpayer, to the government. That it's all undercover, it's all under a shroud of secrecy. Nobody knows how much an aged care facility spends on food. Nobody knows how much they spend on staff. Nobody knows how much staff is in a residential facility. It differs wildly. There are no ratios, there is no transparency of ratios. It's really quite appalling. The Commission recommends improved access to and for quality care for older Australians. I mean, really, that's just quite simple. Minimum time guarantees with personal care workers and nurses are one way to ensure everyone receives the care they need. And you know what else needs to happen? We actually need to pay care workers properly. I have met wonderful care workers in the recent weeks here in Parliament who are earning $22, $23 an hour. They can get more stacking shelves, and yet they are looking after our most vulnerable people, and they are racing from room to room with just minutes to shower and dress a person, and in many cases, if the person has dementia, if the person has incontinence issues, they are needing to shower them many times during a day. They are stressed, they are exhausted, and they are an older workforce of mainly women, and we treat them as poorly as we treat the residents in aged care. Older Australians call for recognition and support for family and friends who act as carers and volunteers, also recommended by the Commissioners. And all agree aged care must be more inclusive, culturally safe and sensitive. Now, the government has allocated $452 million to its initial response, and of course that's really welcome. But I think the Australian community needs to know that that's just around 3% of the total annual budget for aged care. This must be just the beginning of some funding changes. This initial investment must be followed by decisive action now. Significant investment must be made in the May budget, and sound commitment over the long term. The Royal Commission sets out the reasons and the roadmap for an aged care system which acknowledges our older community and the right of all Australians to have care, dignity and respect as we age. And I urge the Australian Government to seize this opportunity to make meaningful change, commencing immediately, for the better. We can't wait 5 years for a new Aged Care Act, and no Australian deserves to wait 5 years for a new Aged Care Act. So while we've been deliberating and discussing appropriations in here for days, it's just another wasted opportunity. I would happily sit through winter break, summer break, every break, so that we can actually make some meaningful change in this place, and in particular, aged care, because our older Australians deserve much better. Thank you.